I've been thinking about simulations for about 5 years. And prior to COVID, having built a lot of the content already for PhysioU, I knew that a new area that we needed to explore was how to contextualize the learning, how to create clinical environments in which the students could play out their knowledge. So let me just take a quick look here. So yep, we've all PT and PTA programs, great. So what I'm going to show you today is the evolution of that thought and how it is becoming things that you can utilize in your classroom. They're the things that I'm going to be using come August 30th. So many of you know me from before. Today, my goal is to spend most of our time looking at Syms. The review of literature, I've kind of abbreviated. There's enough literature in the OT, PT, medicine, and nursing communities in which we know that simulations are useful. But I want to really spend a lot of the time doing the overview of simulations, showing you what they're like, hearing from your perspective. It's very interesting. When you finally build a sim, it's easy to build a sim for your own students, for the way that you teach. But can you build a sim that generally fits with how everyone teaches? This is not an easy task. James and I were just talking this morning about a pelvic pain SIJ case and how tricky that can be if we use lots of terminology like anterior rotations and upslips, things that we all grew up learning about that may not be the part of entry-level education at this point. I'm sure it is in some, and in many it's not. So there's things like that that I think as you begin to see these Syms, you'll begin to appreciate how challenging it can be to create these. And I hope as we push through the challenge, we will find that we have created something that helps students take a step in the right direction. I believe that students need a place to contextualize the knowledge that they've gained and to make some simple decisions in the application of that knowledge, in the interpretation of the findings. I think it's important as they head out into the clinic. And then lastly, I'd like to discuss what you guys think, what you think is needed, what you think won't work in those Syms. So just briefly about James and I. So for myself, this is my 18th year. I have been trying to figure out how to teach better all of these years. I don't think it ever ends. But at some point, I realized that the resources that we had, I needed to build something different. I needed to build something that students could review before class for all the techniques that I'm going to teach them. Eventually, I wanted to build simulations because I always ran out of time. This year in particular, we couldn't even bring in patients. We couldn't do really good simulations. So why don't we build them into asynchronous experiences that we can deploy? That's no matter what happens, the students can do some decision making. So that's really my role in this is I'm largely the idea guy, and I have a bunch of really smart professors, clinicians, residents, fellows. They're all done with residency and fellowship who believe in the vision and are building these. And at the university, I chair the institutional review board. So it's a completely different type of job, but also a fun type of experience. This is James. James is always with me on our webinars. He's building these Syms. That's why he's part of our team. He's past president of the California PT Association. His awards speak for themselves. He's very deeply embedded in government affairs. And he has been building laws and regulations, interactive modules, and James will talk a little bit about them. I'll show you a little bit about what they are coming up towards the end. So James, thanks for always being with us here. And then here, I just wanted to mention that PhysioU and JOSPT have developed a strategic partnership. We believe that journals, it would be great to see videos of techniques, of tests. We don't have to read about them anymore. And so hopefully in the near future, you're going to begin to see case studies that have videos. All the clinical practice guidelines will have PhysioU videos. And it's just an extension of our vision of how research should be implemented and how it can be made into clinically useful tools. PhysioU, many of you who are joining us already know what PhysioU is. It is an ever-growing collection of apps, web apps, that are mobile friendly, that are laptop friendly. And basically, we have targeted key content areas throughout the PT and PTA curriculum that we think will be enhanced by creating apps. And we've been doing this for a long time. So we got faster, as you can see, as we began to figure out how to build these. And eventually we will have probably 80 to 90% of the content areas that are needed for the PT boards, as well as our CAPTE accreditation. A lot of our content will be able to support your students and your teaching. Selfishly, as a professor, I've really dreamt of helping supply content that you don't have to dig around for on YouTube. Things that you know are high quality, that are organized in one place, and that are always accessible to you and the students. This is a tremendous barrier to student learning that I think we can overcome using these types of apps. And I would also add that the web nature of this product means it is continuously being updated. We have a team that is always thinking about how to add good things, remove old things that shouldn't be in there anymore. So this product will continue to evolve, and a lot of it comes from feedback from you. So I'm very thankful as well for you as faculty. So simulations, getting down to business here. So simulations can be described as a technique for practice and learning that replaces and amplifies real experiences with guided ones. And we are building different versions of this, and I'll share that with you. They're often immersive in nature. We have not gone into heavy duty VR because oftentimes there's a lot of time wasted wandering around a room, trying to figure out what different things are. So what we have started to build are much more akin to the choose your own adventure books that we used to read. They evoke and replicate substantial aspects of the real world in an interactive fashion. So a lot of the building of the Syms came out of my own self-reflection of what is happening in higher education. So decreased availability of clinical education sites. Our students are seeing more patients per hour. We are having to take clinical sites wherever we can get them, and they're still not enough. There's also decreased classroom time, decreased face-to-face time. We want to increase experiential learning because we know what happens when you put everything on the table. This is all that you have to learn. This is what I've given you, and you don't tie it to context. You end up with young clinicians who are very confused. They have all the tools. They just have no idea how to build with them. So I really think creating more of I think of it as graded exposure, marginally harder, more clinical, and helping the students develop entry-level practice competencies. I also think that many times our simulations, our mock patients are heavily infused with high stakes feelings, other peers watching, being graded. So I think there's a half step below that. I completely believe in the mock evals, the fake patients or standardized patients that we bring in. It must happen. But I think that's a really big leap if you think about what we do in lab and what we expect them to become. So I think these low stakes asynchronous tools can come in really handy. And they're also more easily deployed. Think about the headache of trying to bring in patients for the foreseeable future. The last thing I would say is, I think there should be a process of the use of simulations throughout a curriculum, that there is a systematic process of unpacking and the application of this learned content. It should be happening regularly, which is why you'll see there's a vast array of simulations that we're building. You don't have access to all of them yet because we're vetting them. We're going through them with a fine-tooth comb. I'll show you how hard that process is.
Michael, this is James, if I can comment.
Yes, please.
Would you go back one slide?
Sure.
That I think that last box is unique to any program. That when and to what depth you use the Sims and unpacking it is very much program specific, and you know your program well. If they're having, you know, the order of the curriculum, ortho, neuro, and then peds, or peds, neuro, ortho, whatever, uh, where they've learned their basic skill set, or if it's concurrent with the clinical science. So this last, I think that last box, the systemic unpacking and application, is very much where you, as the instructor, gets to say, hey, here's the tool, where's the best way to use it, and when's the best way to use it with my students, and when are they ready for it, and stuff like that. So I think that's where the instructor is never carved out of the process here with using the PhysioU tools. I don't know if Mike got dropped.
Yeah, exactly.
Oh,
Yeah,
okay,
great,
thanks.
James. Yeah. I wanted to show you why we built the different types of Sims that we're building. So if you think about Bloom's taxonomy, we commonly think of the simulations as occurring, the benefit of it as occurring up on the high end: create, evaluate, analyze, apply. But I think there's a place for interactive learning, so micro learning. So we're building lots of little mini games that we think help students grasp knowledge, reflect knowledge that they have learned. And so I'll show you glimpses of that. So there's micro learning, which oftentimes they're fast, quick hits. Students love to play these little games when it helps them figure out what they know. So you'll see that we are releasing things called micro learning, which are oftentimes low-level recall type of quick hits, but still very useful. I'll show you how we're doing that for neuroanatomy, for acute care, for wound care. Actually, wound care will be a little bit higher up. Then you've got these micro Sims. The micro Sims are typically shorter. They're commonly patient-based, and they allow for evaluate, analyze, apply. It is a lot more about decision-making, but they're not hours long, right? I think one of the challenges of when we think about Sims is that sometimes they're too big. There's too many choices. It's so hard to get through them that they are almost become undeployable. You can't use them. So I think you'll see that the idea of micro Sims are that when you teach a student about some balance test, wouldn't it be great if they could apply a timed up and go test to a patient? That's a very clear, defined learning objective. It's done in 10 minutes, and it's a clinical application and interpretation of results. So I'll show you that. And then you have this concept of macro Sims. Macro Sims are brutally hard to create. There's a very fine balance between victory, the student being able to make good choices, and challenge. Because in my mind, macro Sims are often more narrative. For example, you're following a clinician as they do a full evaluation and treatment of a patient with Parkinson's or a patient with spinal cord injury. How are you going to engage the student instead of just having them watch an hour-long video of the evaluation? Can we create engagement, decision-making, reflection? And on top of that, can I make a learning moment? So when they put down some of their thoughts, can they see into the mind of the clinical specialist? So the macro Sims are much more involved, much more difficult to build, but extremely powerful. If you could imagine watching a clinical specialist doing an eval and treatment of a patient with spinal cord injury, what does that mean for a young clinician who has never seen a neuro patient before? What kind of context does that create for the learner as they are about to engage with you and learn all the details of the little things that they're going to have to learn to actually do this big process called rehab? So you're going to see glimpses of these different things that we've built. Any comments about that? Or any experiences you guys have had this year with simulations, trying to build them, trying to use them, and what you found to be challenging or really useful? Any thoughts? And you can feel free to just unmute yourself if you have any comments.
Hey, good morning,
Okay.
guys.
Hi.
I like the half-step comment and the graded learning concept. I think that's very valuable, and our role as professors, I think we need to kind of consider that what you're doing is not substituting for the simulations like the patient actors and whatnot. It's just essentially challenging them to think. I think you described it very well as a step between lab and actually the high stakes exam. So I think proposing it in that fashion is going to make a lot of us kind of feel more comfortable with integrating it as not a substitute, but a stepping stone. So I really like that analogy. I think that's very well spoken.
Perfect. Thanks, Tony. Yeah. And please feel free. James is always monitoring the chat. So if you have thoughts or comments, you can keep them flowing in the chat. As we build these Sims, a common challenge is time. You can imagine we've spent a whole year with at least 10 people building Sims. And there is cost associated with it. If you're running simulated patients, you know how expensive and difficult it is to schedule these things. How can we create a scalable solution that is relatively low risk and repeatable, right? And how do you deal with the virus? And now it's brothers and sisters. So, just when I thought that it was time to come out of hiding, we were back to business. I was just talking with my chair yesterday, and she's like, Mike, I'm not sure. We're all going to be back in masks. I would love to keep you in your classroom full of your 72 students, but you're probably going to be in 5 pods of 15 again. So the uncertainty, can we afford to have that level of uncertainty and our students not having the experiences they need to become clinicians? This is what is a big driver for me. That is why our whole team is working around the clock to release these by fall, because regardless of whether COVID is going to be around and affecting our teaching, the students must have a way to unpack their knowledge, to apply the knowledge. This is imperative. So a quick note about building Sims. Sims can go completely nuts. You can have too much stuff in them and they become unmanageable. When I played through our first macro sim, I could barely keep myself awake. It was too big. It was not focused. And yet there were elements of it that were so powerful that I said, okay, we have to keep going. We must refine this idea. So one, how do you determine what areas you should build Sims in? Well, largely you start with a lot of the key clinical areas, right? Where are our students going to head into clinic? How can we develop their reasoning so that they will be better prepared and enhance their clin ed experience? The second thing I would say is, having played through macro sims, we realize there is no way faculty can deploy macro sims all the time. They do certain things really well, but they're heavy, they're big. And so we decided there was a space for mini sims, 20 to 30 minute, some are 15 minutes, some are 10 minutes, some micro learning experiences. Many of them are patient driven, patient contextualized, but they can be short and targeted. And I'll show you what I mean by that. So the ultimate goal is, right, deep learning. Take all of that stuff that's sitting on the table that you've taught them and help them learn how to use those tools. Because then when they go to the clinic, they can actually be effective. This is something I just put together this morning. I was talking with James and I said, it's valuable for everyone to see the process of how we go about it. So we know what are the topic areas that we need to create clinical simulations for. We then go ahead and storyboard them on PowerPoint. We build the whole thing. Every story, every question, every right and wrong answer, every rationale, every reflection from a clinical specialist, everything's written. That's just one game. Then from the storyboard, we know what we have to film and take pictures of. From there, you throw it to the team and the team builds it for the first time using an authoring tool. And then you go through this laborious process of back and forth. Now, the sim builders they're all clinicians. The clinicians then work with the faculty members, and we go back and forth until it is refined to a point where we are comfortable that there is very little confusion that can occur. That's the worst thing, right? For a faculty member is the student goes through a sim, and I guarantee it will happen because we're pushing the limits. We're forcing them to make decisions, to interpret things. But we try as best as possible to keep the sims light, to keep the options relatively distinct, because these processes are asynchronous. There's no chance, no major chance for them to directly ask you questions in the moment, which is why we've put answers or the ability to review the questions they got wrong, or rationale. We've tried to build that for almost all the sims. And then lastly, this is a part that most of us don't think about. We've spent hours turning each individual sim into an accessible piece of an accessible tool for people who need to use screen readers, who need to only use keyboards. So you can imagine that one sim alone can take a month to build. And then we finally publish it. So here are a list of common mini sims and microlearning that's coming. This one has been available here. Oops, let me move back here, sorry. Oh, there we go. This one I will show you briefly has been available for the last 8 months. It's our first virtual reality experience, but it's really cool for gait analysis. Then we've built range of motion, manual muscle test games. These are clinical games based on patient scenarios. Posture analysis and assessment and treatment of those impairments, also based on patient scenarios. Physical agents, neuro exam, all based on patient scenarios. Acute care, these are micro-learning games. Wound care, they're going to be clinical reasoning tools because you're going to follow different.
You froze up, Michael. Right now, you're still frozen. Still frozen, Michael. He's probably re-entering the Zoom meeting.
One thing that he didn't have listed on there that we just recently released and developed for anyone that teaches pediatrics is on the Milestones app. There is a way to have cases in there. And so it compares a child and you can go through and look at what they are doing and then have them determine where they fall in development and then find out if that is the child's actual age or if they're off in their development. And then there's short-term and long-term goals built into that as well. So that's another just micro-learning experience for applying typical development to videos of children that the students can see. That's new and just come out as well.
Is that a paper activity? I mean, is it this is Lane Wilder, is that a paper thing where they can take it and look at, I know there's the children, I've seen some of the videos on the kids. So is that something they just record information on a form and then compare it, or how does that work?
It was hard. It was hard to hear you, Elaine, but I think Jana, I think you got the gist of it, right?
Yep.
So is that a? I'm just coming up. Is that a paper, a document where the students would record information on a form and then compare it, or how does that work? Because I've seen some of the pediatric stuff.
So for the Milestones app, it is all built into the app. So it's hidden, but they can click on it so that they can see the answers after they've practiced. So it wouldn't be something I would say that would be necessarily usable as an assignment just because they will be able to see the answers, but it gives them kind of, again, that low stakes opportunity to see if they're understanding, you know, what they're observing and what it should look like, to be able to make that connection.
If we're just chatting while we're waiting for Michael, I recently used the Pediatric app in our class, and it was most useful for, I know, just finding, unless you have access to that many patients, there obviously no guests are allowed to come in right now with COVID. I'm assuming that's pretty national, but it was very nice to have accurate milestones where if you go on YouTube or try to find them yourself, it's really, or it's not very therapy based. So I was having a lot of friends like, hey, can you put your kid in supine and can you get a rattle, and have them do a lot of very specific questioning. And so it was nice having something that was, you know, there wasn't a lot of distraction, and it wasn't a house, there wasn't a lot of exercise noise, and just to be able to demo some of these milestones. I don't know about y'all, I was using a baby doll as a mannequin for a lot of them, or like I said, some very poorly used YouTube videos. So I thought, in assignment wise, no, but for actual just demonstration and for them to study at home was the most beneficial use of that app, at least for me.
I think what the app does, a couple things is, you know, you go on YouTube and find some stuff, but various students might find a different YouTube video that might have different kind of milestones. But here, so there's one standard thing that the whole class can look at and reference. I was at disadvantage. I was in my early 20s and had no experience with kids, so you know, I felt at disadvantage. The parents had a heads up because they knew when their kids started rolling over and they could sit up. They go, all they had to do is remember when their kid did it. Me, I had to try to memorize this stuff and imagine what it was. So I think that's where it is, and that's with my first fall in love with the PhysioU stuff is with when I was teaching gait analysis and stuff, and got tired of trying to find, you know, or me mimicking a stroke victim walking across the stage, and I just use the videos there. So I think, Elaine, that and Jill, exactly, you kind of use the tool as it fits with you and your curriculum and the level that of information that your students are ready to accept and can participate in. And so, yeah, and that's the variation of, you know, everyone teaches ortho a little bit different and neuro a little bit different and stuff like that in all our various curriculums. So this will give you a good jumping off part for everybody.
Yeah, perfect. Thanks, James. Sorry, guys. So let me actually take you into look at some of these Syms, which is why we're really here. We have built these interactive evaluations. Jaina and her team have been filming PT, OT, and speech evaluations of pediatric patients. Our neuro team here, a group from Casa Clina, PT, OT, and speech, we have been filming evaluation and treatment of neurologic patients. We have filmed acute care patients, acute care settings, and I'll show you what I mean by that. So not only are we trying to address how do we help students learn about what is the clinical reasoning and management strategy for common disorders in the key content areas, but we're also beginning to explore what does it look like to help our students learn, how does an OT do things? How does a speech therapist do things? How can we come together as a rehab team more effectively? Some really cool stuff. We'll be presenting this year at ASAP about these interprofessional simulations. We just got our acceptance yesterday. So let me just show you this real quick. This is the Pediatric Gait virtual reality app. Let me show you on our, let's see. We are here. And there's a number of things that you're going to be seeing coming. One, the search bar is way better. Two, you now have the ability to bookmark anything you want and create bookmarks, collections of videos that you might want to save. So faculty can actually do that now. Or I think we just looked at it yesterday. It should be live very soon. Now, here is the pediatric gait right here. And what we've done is we've taken something as challenging as gait analysis, we've mixed it with pediatric pediatric conditions, and we are allowing, so there's me, to select a patient, Sarah, and you can look at Sarah's history. Sorry, this is a little bit small, right? Spastic hemiplegic cerebral palsy. And we have gotten permission to use the Edinburgh Visual Gait Score. So the students will now observe gait and go through the entire process. So initial contact and stance. This is what we're talking about. That's the descriptor. Sorry, let me see if I can make this a little bit bigger. And now I can say, nope, on that right limb, it is toe contact, and I'm going to keep going. Heel lift and stance. And as usual, there is a descriptor. So the students will go through this, and at the very end, they can not only can they, let me zoom out just a smidge here, pause the patient, use a goniometer to measure things, right? And place a posture grid on the patient, change the view, or rotate around the patient. So we've augmented reality. We've made now analyzing pediatric gait a little bit more systematic. They will be able to compare their scores with a key, and you'll be able to have a discussion about that. And they'll get to play through these different patients. Okay, so that is one way to simulate a very challenging task, gait analysis, and use virtual reality as an interactive experience for your students. So something fun for you to do in your pediatric class or in your gait class. Let me show you an example of, actually, let me make sure I'm not straying too far off. This is another recent app we're about to release related to, there will be different versions of this. The PT version will be functional movement and a task analysis. So we filmed a number of different patients, spinal cord injured patient, COPD patient, post-op, total hip patient. All of these guys, we filmed them doing their common dailies of their common tasks, movements, and that can be used as a library for your students to practice movement analysis or task analysis. Let me move back to my app here. So let me show you actually a macro simulation. So the macro simulations are the big ones. The big one that I'm going to show you here is not available yet for you guys to play with, but let me show you what it looks like. Here is a macro sim. A macro sim starts with some basic learning objectives, view the subjective exam, assess and analyze the objective test and measures of the spinal cord injury patient, and practice documentation of different portions of the evaluation. All right, so where do we start? Well, let's watch parts of the subjective exam.
All right, so welcome. It was a pleasure having you come into the clinic. My name is Mary.
I'm very nice to meet you.
And I'm going to be your physical therapist.
Okay.
So John, can you give me a little bit of background information? I talked briefly to your doctor, but.
So John tells his story, and then we ask students to start reflecting. What do you suspect could be the patient's diagnosis? So I submit it, and here's Mary's thoughts. So anytime we ask a student to put down an open-ended thought, reflect on what you've just learned, we always bounce it off of the clinician specialist's thinking. So the learning can be very engaging. We know open-ended questions cognitively are very heavy. There's a heavy cognitive load. But when you can close off that learning loop with a bit of feedback, I think students will really become engaged in the process. So you watch more of the subjective exam, and you can move on to different parts. So if I go back to the main menu, you can see, oh, let's take a look at dual task tug.
All right, so this next phase, we're going to do the exact same thing. Okay. But while you're walking, you're going to be saying the alphabet, skipping every other letter. So you're going to say A, C, E, et cetera, okay?
While I'm walking?
While you're walking, okay?
Okay.
All right, so.
You got me nervous already.
Yeah.
Okay.
Okay, so you feel ready or you want to rest a little bit?
No, I'm ready.
Okay, ready, set, go.
A, C, E, G, I, K.
So as he moves through this, again, what are some of your reflections? What are some things you notice about his movement? And then Mary shares her thoughts. The patient's velocity slows. He needs to think about what letter to say next. Can you see how this back and forth, asking the student to engage and then backing up their thinking with some reflections from the clinical specialist really allows this process to be formative? My goal here for building these macro sims was a guided tour of clinical practice in a patient environment, a patient-rich, contextualized environment. And so it goes all the way through the game to cover multiple different things: treatment, documentation, assessment of gait, posture assessment, all of these key elements. And remember, we've done this on a patient with spinal cord injury, a patient with traumatic brain injury, a patient with Parkinson's disease, a patient with cerebellar ataxia. So we have 4 big macro sims that are coming that you can utilize to help students see how all of this plays out. So I'm just curious, any thoughts from any of the professors? Any comments?
Not specifically on the macro sim, but a couple slides y'all had interdisciplinary
Yes.
simulation. Speaking, we're in our accreditation period with CAPTI, and we found, especially we're PTA, so
Yep.
we're not attached to a hospital. We don't have an OT program or anyone to pull from in terms of creating that. And so that's actually what I'm most excited about that I didn't know y'all had in the works.
Yes, awesome. I will show you a little glimpse of that. I'll show you a glimpse of how we're experimenting. As you can see, I don't think anybody exactly knows what Sims should be like. So we are kind of feeling our way, testing it within my program and a few other programs, and then refining it. So this is going to be years of development, but you can imagine the interprofessional experience can be greatly enhanced with a little bit of, we can augment reality, and I'll show you what I mean in a second. But yeah, that's a big deal. Let me actually show you a mini game real quick. Here is our neuroanatomy. We have a neuroanatomy app coming out probably by I hate to say it because we've been working on it for a year, hopefully by early September or late September. It's hard to say because it's a complicated app. It's a 3D based app that has learning built into it. It's not just a dissect the brain, the 3D anatomy kind of thing. It's a learning focused app. And at the beginning of that app, there's a lot of mini games that we've built to help orient the student to the fundamentals of neuroanatomy. So here's the nervous system. Let's play the game. Let's orient you to the brain. What orientation of the brain should be labeled? What should A be labeled at? Oh, that should be sagittal. Great, I'm going to submit that. And then what about B? So you can see this is not reproducing. This is not basically reteaching what you've taught them. They're going to play through all of these little games and learn about the different structures, the different lobes of the brain, all of these different things they are going to be able to play through and engage in, and you can actually collect the scores from it. Eventually, what will happen, let me see. This is James's stuff. Let me see if I have it here. I will find it. I'll find it in a second, but you will be able to see the scores for all of these mini games that you can apply to your grade book if you want. Now you'll have to manually have them submit these scores to you, but there's a mechanism for them to email the score to your TA, and they can basically, you can basically get these scores for the patient or for the student. Okay, so I just wanted to show you that there is all of these mini games that we're creating that you'll be able to utilize. The mini games, like in this case, these are what I call micro learning. The students are going to engage in this content, play with it on the weekend, and use it as a way to draw the knowledge out of them, to engage with the content instead of just keep studying, keep memorizing. Any comments about about this micro-learning type of concept?
Mike Granado, you may want to unmute yourself and ask your question, or I can ask it for you. That what you put in the chat?
Michael, just to go back to the neuro scenario where the patient was walking and had this, were the responses in the bubbles, are those editable?
They are not editable by you. They are editable by us, meaning they're fixed. They basically, Mary, she was our professor, neuro professor. She basically said, okay, any one of these questions, I'm going to put my thoughts, what I was thinking in that moment, as a way for students to bounce off their thoughts off of a clinical specialist thought. So,
you know, it would be nice. It would be nice
if
maybe it could be editable, you know, because maybe there might be a specific scenario or a specific situation that the professor might want to focus on, or maybe a certain weakness that we would want the particular class or student to focus on. Just a comment.
Yeah, I think the best way to do that is to open up the sim, go to key areas where you want to have discussion, and then overlay your extra thoughts and comments, because the downside to having something that is reliable, playable, not breakable, is you create a rigid structure in which a student will walk their way through. And of course, the shadow side of that is the rigidity. Like if everybody was able to edit that, then which version will you end up seeing? Does that make sense? So I totally get it. And I can tell you that as I bring that comment back to the team, they will say, Mike, this type of game, we'll have to explore. I don't know. It's not easy to be able to create that functionality, put it that way, because you create inherent instability in the play-through process by allowing, you know what I mean?
Yeah, no, in regards to software reliability, I do understand that. I was just wondering if it was not or not, but yeah, no, I understand, completely understand. It's just a food for thought, that's all.
Yeah, it's a great point, Michael. Yeah. All right, so that's a glimpse of the macro sims. Now, we are also building all of these scenarios that we filmed. So each one of these we have already filmed. Patient with COPD, patient post-CVA. So we are building these as, again, macro sims. What kind of things would you do? What kind of thing would you like to assess? Here's what the instructor, the PT, this is what they were thinking in that moment.
And then last time we used your heavy walker. So we'll try that again today, okay? I'm going to move your Foley cap onto here. That's okay.
Now, these kind of videos, you may be able to use them in two ways. One is we're building sims, macro sims. The second is we will have this selection of videos available in the Acute Care app that you can just reference and use as a way to talk about things, to engage with the students and say, what would you want to make sure you have done before you get the patient off of the bed? So there's a lot of different ways that you can use this content. We will build these all into macro sims, meaning they're asynchronous. There's engagement that's automatically built in. There's reflections from the clinician. And they will be things that students can play through. You imagine, here's your 16-week acute care class. You have them do one every 2 weeks. And it's just part of their exposure. It's graded exposure. It's decision-making, familiarizing them with this environment and this patient population. Now, there's a bunch of mini sims. So the mini sims are available for you to preview. When you log into PhysioU, you should see these little purple things. So let me just give you a quick glimpse of that. Here's what I was saying. This is what happens when a student completes a sim. You get to see their top score, their average score, the number of plays, when they did it, how much time they took on it, whether they passed it. And then they actually are able to send that to you. So when they complete their sim, they see this page and they have an option, share score. So my students will send it to my TA. My TA will log it in as them completing their quiz for their minuscule little points. But I know that they're going to be enjoying their learning. Okay, so just so that you can see, this is another part of the system that we had to build from scratch, because we knew faculty want to know, are my students doing these? How are they doing? And when you see games where scores are low, those are the games that you can target some conversation about.
I have a quick
yes.
question about those
Sure.
scores.
Sure.
Are they able to be uploaded or imported into a learning management system like Canvas, Blackboard, Moodle, things like that?
Not directly, not yet. I'm not even sure how that, I've asked that of the programmers, and they're like, getting different systems to talk to one another is not easy. It's on my list. It's on my list because I know that would be the easiest way. But that would also mean we would have to create a link between the student account in PhysioU and the LMS so that the score is triggered to the right person. It's pretty complicated. So for now, what I'm having my TA do, the students will submit this to them, and then they will go into the grade book, at least my Excel spreadsheet, and they will just mark. They'll just add the scores in manually. It's not optimal, but it's believe me, I'm thinking about it too, because it would save us all a lot of work.
If I may suggest, I don't know if it will work with your app, but currently I'm using visible body apps for my students because we're a hybrid program. And I do have quizzes and things in the app for them to use. And I import their scores using a CSV file into the learning management system.
Yep.
So just tossing that out there as a possibility. I'm not sure if it'll work.
Great point. I will mention that. I think, yes, that might be one way to do it. We could take all of the sims that they've done, and I don't even know yet on the back end whether we can categorize them as here's all the neurosims, you know? So yes, but that's a great point. I'll mention that to the team.
Yeah, we were created some like external links, and that we were able to get not from PhysioU, but things to get to upload directly into our platform.
Oh, good.
Which is kind of like she was saying, kind of nice, but I get it. It's no easy, no easy task. And really we need to see, from my perspective, the sims are the stuff that we can't create, and we can enter the grades. And whether we can create, but it's a lot of work, as you
right
know.
Alluding to.
So, thank you.
Yeah, absolutely. You know, James, if you don't mind, taking down Lori's name, and I think was it Joy?
Yes, Joy Moulton.
Yeah, Joy. We might want to reach out again, because then we can kind of flesh out maybe how that might be able to work.
Sure.
So, great, Joy. That'd be great to touch base again about that.
I'll put my email in the chat.
Yeah,
great.
And Michael Granado, you also he suggested CSV file. So
yes.
Mike, we may reach out to you too. So Joy and who else was that?
Joy and I think Lori.
Okay.
So what I'm showing you guys here is on our development platform. What you're going to see is one sim available for you to play with when you log in. I'm just showing you that these are the ones we're playing with to make sure they're ready for you. Okay. So you're going to get to play with the ultrasound sim later. But here is the ionophoresis sim, for example. It takes about 10 minutes. And it is going to cover everything from contraindications to precautions, using appropriate parameters, applying the modality in a patient case. So here she is. She's an artist. She's having elbow pain, lateral epicondylalgia. What are some contraindications for ionophoresis? So I'm just going to click on a bunch of things randomly here and then move on. Now, the other thing I want you to know is we have purposely chosen to just let students get one try. So they give their best try and they move on. You will get to see their score later, but they can play these as many times as they want. During your objective exam, you note redness, swelling, decreased grip strength. So I'm trying to imply that there is some inflammation present. What would be the most common thing that the physician would have prescribed? Okay, so I'm going to keep going. Let's just say, what position should you put the patient in? Let's say seated on a chair. Now you're ready to begin treatment. Click on the active electrode to proceed. So let's go here. Let's see if that will work here. Your patient only has 15 minutes. What amplitude would you like to set up? All right. I'm just going to click on something random. And you want to increase the amplitude. Click the button that allows you to adjust this parameter. Okay. After the treatment, the patient complains that her skin hurts. You lift the electrode and you notice a light burn. To prevent a burn from happening again, what should you do? So as you can see, some of the games we've purposely put in situations that force the student to go, wait a second, I know how to do this right, but when something goes wrong, do I know how to modify my intervention? This comes from a lot of conversations with you as faculty at both PT and PTA alike. We want our students to know what to do when someone's doing the ultrasound and it hurts. What should I do? And so I hope you can see that we are trying to address some of these things using these kinds of little sims. So the one you'll play with when you log in is ultrasound. You can see in our app that all of these are now, they're all available. Let's see if I go here, you'll see that there's a bunch coming. So here's our orthopedic sims. Let me give you an example of what I'm so excited about for fall. We recently created 4 foundational sims. What do I mean by foundational sims? In orthopedics, you generally manage the guideline-based concept of mobility deficits, people who are stiff, movement coordination impairments, people who are sprain and strain something, some nerve entrapment, so radiating pain, and then some muscle power, some tendinopathy problem. Those 4 common conditions you will see in every body region. Well, we built mini sims. So let's look at the 61-year-old female with hip pain and stiffness. The instructor has some information here that you'll be able to see. Who is this patient? What condition are we talking about? What clinical practice guideline did this come from? These are links. You can link directly to the guideline. The decision tree for hip OA, and what the student is actually going to go through. Okay, so I spent a lot of time building this exact thing for those 4 cases. I'm going to have my students do these 4 sims on the first day of ortho. The game is so simple, and the decision-making is somewhat limited, but they're going to be exposed to a lot of techniques that they're about to learn in the following weeks. So it's actually a really fun, engaging way to build a scaffold in their mind, because once they realize, oh, mobility deficits, I remember that game. We assessed range, we assessed accessory mobility, we mobed the joint, we stretched it with a home exercise program, and the patient got better. I can replay that concept every week for 32 weeks of ortho. It will all begin at this one sim. This is my secret weapon for building context throughout ortho. The kids don't have to know a single thing. It's the first day of ortho, and they will play this game. They'll read a little bit about the subjective overview. They'll look at objective findings. So we'll ask them, hey, based on what you read, what you heard from the patient, what do you think is a key aggravating movement? They don't even know what an asterisk sign is yet, but they can understand what a key aggravating movement is, and they can look at the hints. It's something that currently causes your patient's pain. It may be relevant to their goals and daily activities, and it's feasible to reassess in the clinic. So I think squatting is her problem, squatting and gardening. So I'm going to submit it. Yep, I've submitted it. It stores it. And then you go in and you start looking at the objective exam. They click through this pyramid, range of motion, muscle length. This is what they found. So they don't know yet, but I'm creating a format for them to begin to think about, oh, these are all the basic things I tend to assess in an objective exam. Great. Because they're going to see the same format for all 4 games. Eventually, we pull out a couple of tests that the guideline says is relevant. So let's watch Faber test. My students aren't going to learn that for about 6 weeks, but they get to watch it. They get to engage with
the
it.
Patient supine, flex, abduct, and externally rotate the involved side. Stabilize the ASIS on the contralateral side and press down through the femur.
So what I'm trying to show you is that these fundamental games require very little base knowledge, but they're going to create a really cool foundation for you to build off of. This game goes all the way. This game goes all the way to, let's assess some common activity limitations. What are some tests that you might use for self-report measures? I want them to begin to be exposed to this. These are all linkable. If they're available on the web, we've linked to it. Here are some common tests that the guidelines talks about, and they can watch them because PhysioU's filmed them. And we give them a summary of objective testing. We are now about to go into treatment. Here is the summary of the findings. So we summarize it for them. And we give them something simple like, hey, so of all these categories, what do you think would this patient fit? Oh, they don't have enough range. That's mobility deficits. This is the beginning of this conversation that I reuse these terms every week of ortho. And then they get to watch a short video from one of our apps about hip pain and mobility deficits. What are the common findings? Once they're done, they get to make some decisions about what should I reassess before I start treating. So I think I want to assess their squatting. Great, you were right. This is something that she mentioned earlier. Do you see how I'm beginning to build this idea of how you gather information, how you assess and reassess? Later, what you'll see is under the interventions, they're very straightforward. Do you want to strengthen her? Do you want to mob her? Or do you want to teach her good posture? So the answers are so simple, and yet it's so profound that you are connecting impairment to intervention strategy. You're connecting a manual therapy intervention strategy to a home exercise program. It's all going to happen in this one game. And then they're going to play. So I'm going to go out of this. They're going to play all of these 4 different conditions: ankle sprain, cervical radiculopathy, hip stiffness, hip mobility deficits, and Achilles tendinopathy. They're going to learn the basic evaluation and treatment strategy of these 4 common conditions, and I'm going to piggyback on this concept for the rest of ortho. The other thing that you'll see that we're continuing to release every week, we're building a new one, is that there will be upper quarter games and lower quarter games that will cover many of the common conditions. These ones take about half an hour. There's a lot more decision making. They're meant to be used at the end of knee week, at the end of hip week. And the students will actually be able to play through some decision making about eval, treat, exercise, reassessment on the second day. All of that is built in. So when you think about, for me, even when I think about the PTA student, many of these games will help them see the big picture. How did the patient get to this point where now I'm seeing them on the return visit? Every one of these games has a return visit where the PTA has to make the same decision as the therapist. So I think these can be easily used as a way to help the PTA student build context as well. Let me take you, I know we're probably pretty much running out of time. Let me just show you that range of motion MMT, we have a bunch of mini games. These are little 10-minute patient scenarios asking students to reflect on axis, stationary arm, movement arm. What are the normal ranges of motion? We just contextualized it with patient cases. Okay, so you guys will be able to play. There's one available for you to play with. We are fine tuning all of these, but you can see they're almost ready to go. There's range of motion and there's MMT games. There are, I wonder, you kind of saw the dual task tug, but in the dual task tug, that's an example of the neuro mini games that we have. Timed up and go, modified Ashworth. These are all on real patients. Romberg, sharpen Romberg, 5 times sit to stand. All of these will be available for you. The moment we have them ready, we will send an email out so that you as faculty will be the first ones to know to come play through these and determine when do you want to deploy them. Our faculty will deploy these at the end of balance week. So we're doing balance. Here's a couple of balance tests I want you to play. We're talking about tone. Here's modified Ashworth. I want you to play that. So these are short mini sims, easy to deploy, useful to help the student get a sense. How does this look like on a real patient? And then lastly, I think what I'll show you is these little acute care games. Here's microlearning. All your common indications and precautions, the students have a little mini quiz to go through. Recognizing lines and tubes, recognizing common braces. All of these, there's going to be an EKG, heart sound, and lung sound game. All of them will be here for you to deploy. Okay, simple little fast games for students to use for their own learning. You can give them quiz points if you want, or the students can use it for their own learning. In the last couple of minutes, actually, any comments about that? And I'm just going to close this off. I know everybody has to move on. We're working on this app right now. Any comments? Okay, so remember that when you guys log into your account, when you look for these little purple icons, there are sims there for you to try out. Probably within the next couple of weeks, all the sims that I've shown you are going to be live on the app, and you can play in more depth through all the other ones. Okay, so the orthopedic sims, the neuro sims, here's the neuro sims, the acute care mini games. Here's just a glimpse of what we're doing with interprofessional education. So we brought everybody in, the patient, doctor, OT, speech, PT, nurse. We brought everybody in, and they all did evaluations and treatments on this patient. Now, how in the world are you going to create an experience for a student to be able to go through and still, I mean, that won't take 5 hours long. Well, the way we're doing it is all students get to watch the physician and the nurse do their little bit, okay, because it's short. If you are a PT student, you will go through a PT track where the exploration and viewing of the PT eval and treat is a little bit more detailed, a little bit more. But you'll also get to choose and watch an abbreviated examination and treatment by OT, abbreviated examination treatment by the speech person. And then there's reflection questions along the way. And at the end of it, so you can see here, so here we are filming, watching each other perform the treatments, perform the examination. And when you're done, you will get to see an interprofessional discussion. All the people around the table sharing, what should we do to help this patient? Now, the students will also get to reflect. And the way we're building this, we're experimenting right now. We're experimenting, could we have a number of different programs all come in here and do this together, PT, OT, speech, and have them discuss in a discussion room, and then have them watch this, or vice versa, have them watch this first and then bring out further discussion. All of this is asynchronous, completely built into a module that you can say, all right, guys, at noon, we are starting this module. Everybody go. And everybody will have this cool experience. And the experience is catered to each profession. OT will get to go down a slightly different route where the OT exam is a little bit more detailed. and then they watch an abbreviated PT and abbreviated speech. We're doing this exact same thing with pediatric examination and treatment.
Oh, let's go get Nikki. Oh.
Now this is early intervention.
Can we sit back right there? Yeah. Do you want more? Sit right here. Can we sit back down?
So I hope you can see the vision that PhysioU is trying to bring to the academic environment and the effort that we're putting in to try to bring these tools to support you as educators and support our students, my students and your students alike. We're thinking outside of the box. We're doing things that are extremely expensive and very difficult to do, particularly in COVID time. But our students deserve this type of learning. And I think we as faculty could really do amazing things with these types of resources. The last thing I'll show you is James's baby. James, as past president of California chapter, we heard from all of our students, we hate studying for laws and regs. We hate reading these PDFs. I mean, I'm not even thinking this as, because not every state has a jurisprudence exam. And yet our students need to learn how to be ethical, law-abiding clinicians. Well, we built all of these into scenarios, scenario-based learning related to supervision, let's say. And James, do you want to just mention anything before I go into this?
Yeah, I mean, I think that there's two kind of components to this. Number one, the entry-level practitioner who does have a jurisprudence exam for entry into the profession. The latest stats I have is 78% passing rate, which is what, 22% failure rate nationally and in California. So that's unfortunate because it's delaying their entry into the profession, and their income potential is being delayed until they get that done. For the in the coursework, I mean, to go over the laws and regs for safe and efficacious practice, so that when your graduates, even though they're in a state that doesn't test them, they still got to practice ethically and lawfully. And so that's part of the curriculum in CAPT that you need to teach. And so it's you know, an important component for your CAPT accrediting requirements for your curriculum.
Yeah, what you can see, I mean, this is laborious work. James is doing this for every state. So we have a team. We're combing through the differences. We're rebuilding each of these games for each state. I mean, it's going to take forever, but how valuable will that be for your students to be able to play through these and learn about supervision, learn about documentation? They can play through it and learn it. So I think I'm just going to close this out. I'm open. James and I, Jana, we're all here just to hear your thoughts. Any comments? Any questions, thoughts about what else needs to be built, or concerns even that would help us kind of modify what we're doing? Any comments or thoughts?
Michael, this is Nancy.
Hi, Nancy.
I'm sure when we have a chance to actually try out these apps, we will certainly have some comments and thoughts.
Yep.
So it might be good to check back at, you know, once these are launched for us to use.
Yeah, absolutely. I think that's a great idea, James. We could mark that down as once faculty start playing with these, I'm sure there's going to be lots of comments and feedback. I mean, this is a moving target. No one really knows exactly how these should be built, what they should look like, how many times should a student have a chance to play through a sim, you know? So there's a lot of unknowns, but yes, definitely, Nancy. I think we'll pull together a group of people who want to, where there's no more demo. It's purely about, hey, could you pull this up? Could I show you something that doesn't work? Or have you considered this, you know?
Can you reiterate, Mike, the timeline you think of getting these out? Nancy wrote that in the chat. She was curious as to when they might be available for release.
Yeah, the team wanted to release them this week. I think within the next 2 weeks, meaning before September, they will be live, available for you to play with. And, you know, my sense is that the first round of using this, you don't let it be scored. Let it just be for learning, formative. So you can experiment with it with no risk. That's what I'm going to do. The students will do them because they're engaging and it helps them to learn, but you minimize all of that points stuff. Just let them enjoy the experience and then see if you can build on it. I do think it is valuable. Like, for example, after I do those foundational 4 ortho sims, I'm going to have a short discussion about all of them, because I'm going to segue all of that concept. I segue all of those concepts that have developed through the playing. I'm going to refine them and prepare them to reuse those concepts every week of ortho. It's changed the game for me to have those basic concepts created as a framework in their mind. Yeah. Other comments, James? I'm looking at the chat as well.
Yeah, for students as well as faculty, or just students, or just faculty for now?
When we release it, it will be available for all, but that doesn't mean that students go wandering in looking for things to do. That's what we've realized. We've released lots of things that students have not explored because they've got 10 other things that they need to do. So I don't think students will know to do these until a faculty member says, hey, I put a link for this sim in your LMS for this date. I need you to do that before you come to class because I want to discuss it. So the way I'm going to deploy it is I'm going to take a link. So if you go back to the actual, you can't use this link because it's not really on the live platform yet, but you're going to be able to go into here, take a game, grab the link, and put that into your LMS and say, guys, this is your homework before you come in next week. Please finish contraindications precautions. Or please finish the frozen shoulder mini game or the timed up and go mini game. So you can put that, and all the students, when they click in, it's tied to their account. So they will be able to finish it. If you want them to submit the score, they can submit it to you. That's very easy to do.
We've gone blended at our program. And so I'm trying to incorporate as many of these things into the asynchronous assignments and link them directly. So it's super easy for the students to access them. And I can give them credit for the time. I'm not even really that concerned with the score all the time.
That's right.
To give them credit for the time. And then it's their loss if they don't take full advantage of, watching the whole thing.
That's right. That's right. And I think eventually what you'll see in the neuro is you're going to see macro sims show up, and you're going to have these big ones. The big ones, I think what we're going to do is, they don't have to know a ton to go through it because eventually they see all the answers, but they're going to learn a lot by going through the experience. We have some that we've filmed. We have some amazing ones that Sarah Kraft has created out of MUSC. All of them are coming into NeuroSims. The NeuroSim stuff is really going to be amazing. So all of that is in process. I can guarantee you that what you see here now, here's the neuro stuff. Here is the, I didn't even get a chance to show you. We did some cool little games for posture. I think it's actually right here. I was like, hey, James, you know how we teach posture in year 1? The students don't remember anything about what to do with it besides, yes, that's a kyphosis. So I said, why don't we make it such that when they play this game in year 1, they will go, oh, there's a patient that has pain. Oh, and by the way, this is what his pain's like. I know they don't know much yet, but they know how to look at posture. They can tell that he has excessive lordosis and an anterior pelvic tilt. So I'm going to ask him about it. What do you see? What do you think's tight? What kind of stress does this place on the spine? What kind of pelvic position did you see? What do you think is tight and long? Right? So I think if you think about it, it's really just a stepping stone from posture. You're connecting the dots to anatomy, and eventually I'm going to ask them simple questions. Oh, so here's a video. This is how you normally assess.
With the patient seated at the very edge of the table,
hip flexor leg.
Have her grab the involved leg underneath her thigh. Help the patient roll back by grabbing the other leg.
So it's essentially like
down.
Go back here.
Palpate the ASIS on the.
So they will get to watch a few short videos. They don't know any of these tests yet, but can you see how quickly we can connect dots that often are never connected? This is going to be the games that they play during their kinesiology range of motion MMT class. They've got range of motion games, MMT games, and they've got posture games that they'll be playing. And then I'll ask them, hey, by the way, they had short iliopsoas. What would you like to do for treatment? None of these other things are impaired, or at least they don't know that yet. So they said hip flexor stretching. At least they could give you that answer. Okay, yeah, that's something we have to fix. It should be hip flexor stretching. Oh, here it is. Great. Let's watch a video of how someone does that. And so there's a quick video of how to do that. Do you see how you've just made posture a lot more meaningful? And when this management is done, you see a patient, their posture is a little bit better. That's how I think we create clinicians. We help them take a half step forward instead of have them myopically staring at the only thing we can afford to teach them in the short time that we have. Any thoughts about that? I know, James, you haven't seen it. No one's seen it, actually. I just came up with the idea probably over fish tacos somewhere.
Yeah.
What do you think, Tony?
Yeah, I think you kind of answered my question somewhat with that posture idea. I was actually going to ask that when you were doing the pediatric demo and you could get the goniometer and the posture grid out for the pediatric patient, if that concept was going to translate towards, maybe some of the inpatient settings or the outpatient videos that you had. But this is a specific, separate situation, situational app for posture specifically.
That's right.
Okay.
Because it was a problem that I think needed to be solved.
Yeah, I agree. Yeah. I just like the concept that you had specifically for the pediatric patient, because you're kind of reintegrating those basic skills in that setting. I thought it'd be nice if you could take that into like the orthopedic or maybe, some of the other ones as well, because it just seemed like you were integrating some type of grid or, software into what was already recorded. So it kind of gives the student the context of, we're doing a clinical evaluation, but now we're revisiting these old skills in that context. But I think you're doing that with what you have there with the posture, because it was a story. It wasn't just an isolated skill. I do have a question, Mike, and I apologize if I missed it. I did see that you had little time snippets on the mini assessments or the macro assessments. So just in general, just for like kind of future course planning discussion, are the mini Syms and the macro Syms designed to be certain times? Like it seemed like it was 10 to 20 versus maybe an hour for the macros. Like, could you just kind of comment on that?
If you think about the typical macro Sym, which goes through a full treatment during an acute care setting or a full eval and treat during a neuro eval, those will likely take about an hour. And depending on how fast or slow, I mean, how long someone takes to think about what they want to write in an open-ended question. So I think those need to be judiciously spread out, They can't do those every week. It's like you
when you say an hour, you mean an hour for the student versus an hour for discussion afterwards. You mean an hour just
for the student completely.
Gotcha.
Yeah.
Okay.
And potentially even a bit longer, but a lot of the short mini games, like some of the ortho mini games, they can take 20 minutes, 30 minutes. And a lot of that is dependent on how quickly the student gets it. They're like, oh, I know that answer. And they just move on versus sitting there thinking about it. The ortho mini games are a little bit longer. They're 20 to 30 minutes. But some of the range of motion games, some of the acute care games, the neuro games, they're 10 minutes and they're done. And so those are some of those games you could just say, hey guys, at the end of this class, I want you to break up into your Zoom breakout rooms and I want you to do timed up and go together. fine. Use it as a group activity. Or you could say, nope, I have taken each one of those mini games and I have strategically embedded it in my syllabus so that you know exactly what game I want you to play during that weekend. And I'm going to talk about that game when I get to class the next week. So I think you can use it in lots of different ways. I don't know whether students, when I was a student, I didn't randomly open a textbook and wander through chapters. I read what I was told to read. So unfortunately, students in this generation, I think, will also need you to deploy them and need you to help them unpack it as well. There's going to be inherent learning that's going to occur, but I think the power comes when a faculty member can creatively and strategically place these and then leverage those experiences into a talking point. So
very well put.
Yeah. So you'll see that that's why we've built a lot of small things. Small things are easy to contain the damage or maximize the benefit of what they've learned. Big things, it's like a big oil spill. If it works out well, you have a tanker full of oil. If it doesn't work out well, you're cleaning oil off of the beach for weeks, right? So I think that is the challenge of sim development. How big or how small they are really determined by your learning objective. What did you want them to get out of it? Teaching clinical reasoning is no small task. Oftentimes you play a 10-minute little blurb about posture. You've taken them one half step further, but that isn't the big picture. But when you see a whole neuro eval, wow, imagine what a student could come out looking like if they could see a specialist do 5 evals. That's huge. So yeah.
And it's requested too, I think. So that's definitely filling a gap there.
Yes.
All right, thank you.
Yeah, thank you. Any other thoughts, comments? We're not in any particular rush, so we're very thankful that you guys have thoughts and comments about this.
I think it's interesting to see on the score of the mini games, the mini sims, Mike, that there's actually a timestamp. You can see when they've done it. And if like 5 minutes later, they took it a second time, or if it's, 2 hours later, because they had to go do some research because they did poorly or whatever. And then you can kind of see also the amount of time they spent. And I would probably suggest that as they do the games, they'll start learning how they've learned and would be able to go, oh, I'm using that pyramid. Yep, I got the pyramid down now. I'm able to progress faster through the mini games now. So I think that can be an indication. And again, it's a tool.
James, we just lost you for a sec.
Nope, I'm back.
There you go. There
Sorry
you are.
about that.
No
Yeah. So I think it's very helpful. The tool is a tool for you to use in various ways in your curriculum. Everyone review it before class. We'll talk about the first 5 minutes of lab or something, and that way they can see it all. It's like, especially now with COVID and with HIPAA and stuff, I think less and less, fewer and fewer students are getting clinical experience before they get into the program, either as a PT aid or an OT aid. And so this lets them see it, pictures worth 1,000 words. They see, oh, that's what a hospital room looks like, and stuff. So tons of stuff to, So you see the second time the person was what, a minute and a half shorter or 2 minutes shorter. Yeah.
Other comments? And feel free to just unmute yourself.
Where exactly can you see the students and where they logged on to do the simulations? I didn't know we could do that.
Well, the way you do it is you can't. It's in this is their private information that they choose to share with you. So when they finish a game, they come to this page. They go here, and actually in the version that's when they're done playing it, what you're seeing here is what I opened as a faculty member. They sent me an email that says, James Syms did this game, here's his scores. But the student has the option to click a button that says share score. When they click on that button, they can put in the email and you will get a link. So my TAs are going to receive all of these, check off that the students have done them, and then I'll give them, if we want, a participation point of some sort. So for now, it is also insanely difficult to create cohorts. So if you think about right now, anybody can come into PhysioU and play this game. and they can share that score directly to you as a faculty. But how does PhysioU create a cohort? Do all of your students have an account? How do we link that cohort to you as a faculty? It's insanely challenging, and it's on our list. It's just building other important apps is also on our list. So it will come in an evolutionary kind of process, but for now you can't see this unless they share the score with you. So we'll teach the students on the first day of class. I'm going to show them, when you play through a sim, when you are done, you need to share this with the head TA. He's going to give you points for that, and then it's automated from there. I never have to worry about it as a faculty member unless you don't have a head TA. But if you do have a grad assistant, then I would just let the grad assistant take care of all of this.
Thank you. That's what I figured, but I just was like, ooh, that's cool.
Yeah. It would be nice if I've asked the team about it. Can we create cohorts? We can, but usually creating cohorts is done in an LMS. This is kind of a minimalist LMS. Can you imagine me forcing you as a faculty member to deal with Canvas and now deal with the PhysioU LMS? It's a double nightmare. So we've figured, let's make this as user-friendly as possible, even though it is not as nicely synced as a true LMS would be. It's always a compromise. Other comments? And Cheryl, thank you so much for your comment. Yeah. It's exciting to share these kind of things and to build these kind of things. It can also create a little bit of anxiety because you know that all of these things will be up for scrutiny. But what can we do? We know that students need these kind of things. And so all we can commit to is continue to refine them and make them better and better over time. So yeah, I appreciate your support, Cheryl.
No worries.
Thank
I love
you.
what you're doing.
Thank you.
And, don't worry about, criticism or, what I've done is I just play, like for modalities, it was a lifesaver.
Yeah.
I play the video, and then the other instructor and I would just kind of go through and critique how we would have done it.
Exactly.
Or different, different ways, but it's a great starting point when we can't gather in a lab.
That's right.
And
not every, we got a lot of feedback about transfers. Everybody does it a little bit different.
Right.
But you have a video that you can start with and you layer on your expertise.
Exactly.
That's exactly how it should be done.
Exactly.
I think it's like, the analogy of driving a car. You learn how to drive a car with a brake and a gas pedal and a turn signal. Where it is specifically in your car and how you drive is totally up to you. And so it's a way to do the modality. It's a way to do the transfer. It's not the way. And in athletic training circle, I say as many trainers you could fit in a training room, there's that many ways to tape an ankle. All of them are acceptable, not just my way. Yeah.
Right.
So,
and
yeah.
also we both learned, a couple of new ways to do things.
That's right. That's right.
Everybody's learning.
And just so you know, because all of you have stayed back so long, I want to show you that these two things are about to come. They're actually, as you can see, on our development platform already. And all of this is done by Patty Nelson out of Texas University in Texas. It's not the Texas University, but how cool is it that she is an artist and she draws all of these structures. She teaches you to palpate them.
For soft tissue structures on the dorsal side of the shoulder complex, we will begin by identifying the trapezius, which is also made up of 3 parts. To identify the upper trapezius, have your patient shrug their shoulders. The upper trapezius originates on the occiput and spinous
awesome.
Is that incredible? So this includes all of your bony and soft tissue entrapments and nerve entrapments are now drawn onto the patient. And your students can now use this as a way to learn how to do palpation.
This is awesome.
Isn't that incredible? So
Is this live now?
We are in the refining process, meaning we make it, we put it in the development platform. The author goes through and critiques everything and voiceovers and changes text. It will be ready before September 1st.
Oh, perfect.
So this will be available.
My kinesiology class by 1,000%.
Exactly. You never have to do it anymore. You just put the video up there. They reference the video. And then we just finished the evidence-based taping app. So your students can watch videos of the history of taping. These are little mini TED Talks. Clinical reasoning for taping. We did this with a couple of professors from Australia who research taping. What are some application, optimal position, applying, removing tape, right? How do you do that? All of these are little things that you can just log into your syllabus. They watch it on their own. And all the tape jobs, so here's a consent form. All the tape jobs are here. Oh, here's materials. Rigid tape, elastic tape, different types of elastic tape. What are they? What are they for? Why you might use them? And then we did a literature review of the most common tape jobs that we think should be an entry level. Now you have liberty, of course, to teach whatever you want, but we think that if we can minimize the variation, why not? So here you have all your external support tape. You can choose to look at taping by condition, or you can do it by impairment. Like, what are you trying to do? And each of these will have, what do you need? How do you measure? So these are short video clips of measuring. How do you tape the actual tape job? So you could just put this on the screen. Everybody in every pod watches the same thing, right? So you can see that. Sorry, I think my internet's a little bit slow. You can watch the high-speed video. So the high-speed video basically takes out the volume and does the entire thing in high speed. There's the 360 view. So now you get to look at what does the tape job look like in 360. And there's the step-by-step. We also added this idea of reassessment. So for all the tape jobs, what are the common things that your patient should do to reassess if it made a difference? Here's patient education. All of our students will read this, but they will also be able to email or share this page to patients. And if they can apply the tape job themselves, so some of them they cannot, but if you look at a different body region, let's say ankle and foot, and you said, oh, I need to do some, let's see, Achilles tendonitis, let's say Achilles tendon unloading. Under patient education, they can watch a video from a first person perspective. So if it's your right leg, they get to watch someone, the patient wearing a GoPro on their head, doing this actual tape job. And if it's the left leg, you can mirror it and you can share that with your patient. And they will have all the basic information. How can I reapply the tape myself? Here's the instructions. When should I remove the tape? All of this stuff is all here for them. And then here's the evidence for this particular tape job. And here's a consent form that you can consider using for taping. Brought to you by PhysioU. What do you think?
Super cool.
Isn't that insane? Like my wife is always like, Mike, you need to calm down. You have 3 boys. They need you to focus. I'm like, I can't. We're building cool stuff. So it's, yeah, it's just me and a bunch of cool people building cool stuff. So. All right, gang. Any other comments or questions, thoughts? We are keeping track of all the things you're saying in the chat. James and I always have a little discussion towards the end, but I want to thank you for being a part of this journey with us. Feel free anytime to reach out to me at mike@physiou.com. And hey, if you have ideas, I'm all ears. we're constantly building, and your support, the students and their subscription, just know that this year we have moved back to our $99 a year subscription price, which is the price of one textbook for all the stuff that we're building. So that support helps us to pay patients, helps us to pay for the studio, helps us to pay programmers. You can see that we're putting that money to good use. So anyways, thank you guys so much for being here for this long. And this video will, I think, yes, it will be available for you guys to share. You will get a link, and you can always share this with your colleagues if you would like. So thank you, everybody. I hope you enjoy the rest of your summer and look forward to being in touch. And Nancy, if you're still there, we'll pull together a call in 6 weeks or so. Thank you, everybody. Good to see you, Ayman.